Welcome to the MamasteFit podcast. In this episode, we're going to be chatting about how you can use your prenatal fitness to stay strong throughout your pregnancy, pain-free, and then also to use your workouts to actually prepare you for birth, because our prenatal workouts have to be more than just a collection of pregnancy-safe exercises. So it has to be more than just omitting our sit-ups and running. We want to ensure that the movements that we're incorporating into our prenatal workout routine are also helping to prepare us for our birth. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We're glad to have you with us on this journey and that you have chosen us to support you. In this episode, we're going to be chatting all about what type of exercises that you should be incorporating into your prenatal routine to help you stay strong throughout your pregnancy, pain-free, and then also to create more space within your pelvis, release tension in your pelvic floor to help you prepare for birth. Before we dive into the episode, I want to share that my book, Training for Two, is now available for pre-order. Training for Two is all about how you can use prenatal fitness to support your pregnancy so that you can move confidently. We have trimester by trimester lifting modifications in addition to pelvic stability and core exercises to help you stay pain-free, plus those pelvic opening and pelvic floor exercises to help you prepare for birth. And so a lot of what we talk about in this episode is going to be in the book, but there's so much more in the book as well. We also incorporate what exercises that you can do if you're preparing for a cesarean birth, plus some exercises that you can do postpartum as you begin the recovery process. The book comes out September 10th in 2024, and you can pre-order it down in the notes below. So when it comes to exercising throughout your pregnancy, there are tons of benefits for both you and for your baby. And even though it is incredibly beneficial, there is still a lot of misconception and myths on whether or not exercising is safe for you. You probably had some random person tell you that exercising is dangerous for you and your baby, or they're urging you to be super careful. Or maybe you have some really rude people that are telling you that you're being super selfish for exercising throughout your pregnancy, which is blows my mind because there's so many benefits, not only for you, but also incredible benefits for baby by exercising throughout your pregnancy. Some of those include their brain development has improved, their nervous system is improved. And so within the first year of life, they have more cognitive function, they have improved language skills, they have improved motor skills. And so those are big deals to me. And so it always blows my mind that folks are this is really unsafe for your baby, how selfish that you're being. But let's break down what the recommendations are for exercising throughout your pregnancy from the governing bodies of medical professionals. So Roxanne, what are the recommendations for exercise?
The recommendation is exercising at least 150 minutes a week of moderate intensity exercise. And this is for most governing bodies of either OBs or midwives within the world. Particularly ACOG is the one that we cite in a lot of our research, or as evidence that they recommend 150 minutes of moderate intensity exercise a week. This could be 5 days of 30 minutes of exercise. It could be 2 1-hour workouts and then a 30-minute in there. However you want to split up 150 minutes throughout a week with moderate intensity. So your heart rate does need to increase a little bit at least throughout the week. And then this could be any type of exercise of walking. You could do biking or the Peloton. You could do yoga. But they also recommend resistance training as a great option during pregnancy. And we know from Gina all of the benefits of resistance training during pregnancy, but it also is proven as a really great option all throughout life to decrease the amount of pain we're experiencing and just be able to move through the world more comfortably.
And so resistance training is not only beneficial to improving your insulin sensitivity, which is huge for decreasing the risk of developing gestational diabetes, which could impact baby's development, but it's also really beneficial to, like Roxanne was saying, to reduce your discomfort during pregnancy. Plus, resistance training helps to increase the density of your bones, which again, I've been loving these reels and memes that I've been seeing online where it's like, I'm not training for my summer body, I'm training for my old lady body. The same concept applies during pregnancy as well. Like, we're not only training for pregnancy and for birth. When we're lifting weights during our pregnancy, we're also training for the postpartum as well and for our long-term health. And so because there are so many myths about the safety of exercise throughout pregnancy, it can be really hard to feel confident about moving your body and going to the gym and being like the recipient of all this unsolicited advice. And so if you want to dive specifically into the myths of prenatal fitness, we do have an entire podcast episode that breaks down like the common advice that people are receiving throughout their pregnancy, the common concerns they have, and we'll link that down in the notes below. But the most fearful one that I usually see is whether or not exercising throughout your pregnancy is going to impact the length of your pregnancy. So is it going to cause a miscarriage or is it going to cause preterm labor? And the answer is no. Research repeatedly demonstrates that exercising throughout your pregnancy does not increase your risk of miscarriage. So miscarriage and pregnancy loss is a common occurrence. About 1 out of every 4 of us will experience a miscarriage. And so it's important to note that your exercising did not cause your miscarriage. There are usually other things involved with what may have caused that pregnancy loss. And it just makes things way worse when someone then blames you for the loss, like you were responsible for it when you're already in this grieving process, even though your workouts had nothing to do with your pregnancy loss. And again, research has repeatedly demonstrated that exercising throughout your pregnancy does not increase your risk of pregnancy loss, and it does not increase your risk of preterm labor. And so if you want to dive deeper into the myths of prenatal fitness, again, we do have that entire episode that we did all about it. And so for the majority of us during our pregnancy, exercising is perfectly safe to do. There are some complications that you may develop during pregnancy or like pre-existing conditions where exercise may be contraindicated, but typically your provider communicates very clearly to you that exercising is not safe. So if you do have any questions or concerns on whether or not you should be exercising, like having a conversation with your provider is a really great place to start. And so now let's talk about what can we do during our pregnancy to support a strong pregnancy, to support a pain-free pregnancy, and then also to help us prepare for birth. Because like we said in the beginning, our prenatal workouts need to be more than just a collection of exercises that are deemed pregnancy safe. They have to actually be helping us to move better during our pregnancy and then also to create more space within our pelvis. And so the first thing that we want to consider when it comes to how we work out throughout our pregnancy is we want to ensure that we're moving in all 3 planes of motion. So we have the sagittal plane, which is front to back type movement patterns. Typically, this is going to be movements like squats or deadlifts or like bilateral movements, which means like both legs and both arms are kind of working together. So these movements are all like front to back. And we live the majority of our life in a front to back type movement pattern. So it makes sense that this is really common for us to be incorporating within our workouts. But we also need to be incorporating the frontal plane, which is side to side type movement, and then also the transverse plane, which is the rotational movement. And now you may have been told twisting is dangerous during pregnancy. You should never twist or only do open twists where like you move into more external hip rotation. However, it is safe to find internal hip rotation and find closed hip positions and twists during pregnancy. I would highly recommend it as well. It's not dangerous for you. It's not dangerous for your baby. If anything, it's going to help to increase your comfort during pregnancy. And if we completely neglect internal hip rotation and closed hip positions, we're going to be decreasing space within our pelvis as well. So absolutely twist during your pregnancy. So within our workouts, we want to incorporate a combination of front to back type movement patterns, lateral or side to side type movement patterns, plus rotational type movements. With the side to side type movement patterns, this could include like sidestepping or like lateral band walks. It also includes like cable pull downs where essentially like the arms and the legs are doing abduction. So they're moving outwards or away from the center, or adduction. So they're moving closer together. And so we want to incorporate like that side to side type movement pattern. And then rotational movements in the transverse plane tend to be more of that internal to external hip rotation within the spine. And so we want to incorporate all of those different types of movements within our workout programming. And now if you already feel a little overwhelmed by like well, how do I incorporate 3 planes of motion? Like, what does that really mean? We do have our prenatal fitness programs that are just daily workouts that we already incorporate all of this for you. And so you don't need to reinvent the wheel if you don't want to. If you do, definitely keep listening to this podcast episode. Definitely get my book Training for Two, because we're going to break it down so that you can kind of figure it out on your own as well. So what does a typical workout look like where we incorporate those 3 planes of motion? So in our programming, this is a good example. The first one is going to be, we have a squat movement. So this is going to be the sagittal plane, that front to back movement pattern. This is a lower body strengthening exercise. It's also a core exercise because we're maintaining our torso position as we lower up and down. We can pair that with lateral step-ups where we're stepping up onto a box. So now we're moving into the frontal plane. So we're stepping sideways onto the box to step up and then to lower back down. So we're moving this side-to-side type movement pattern. With the lateral step-up, we can also incorporate the transverse plane. So these movements are not like moving in isolation. Like they can kind of combine planes as well. So we're stepping up sideways. And then at the bottom, we find more of that internal hip rotation. So you're bringing your belly towards your thigh. And then as you step up, we find more of that external hip rotation. So you're facing more forward. So we're incorporating that hip rotation as we find more hip flexion at the bottom, and then as we find more hip extension at the top. So that's like a great way to incorporate a frontal and transverse plane movement together with the squat movement, which is that sagittal plane. If you want to get more into the frontal plane, we could throw in some band walks or lateral band walks, so we're solely in that frontal plane. If we want to focus way more on the transverse plane, we can also do rotational movements like adding in some lunges with that rotational movement in addition. And then another thing that I've really been enjoying incorporating into our mini strength circuits is also like hip shifting exercises, which is more of a transverse plane type movement because that brings a lot of pelvic rotation in as well, not just hip rotation. So it's a little bit different between like what the femur is doing within that hip socket versus what the actual pelvic bone is doing. And so those hip shifts can help with that transverse movement within the pelvis, which is really important to creating space throughout our pelvis, and then also impacting the tension within our pelvic floor. So when it comes to the pelvic floor, one of like the big concerns about lifting weights during pregnancy is that it'll make your pelvic floor super tight. And this is something that I hear like repeatedly from birth workers. So like doulas, from providers, from nurses, like anyone that's kind of working in the birth world in a professional setting. It's a really common sentiment to believe that if somebody's lifting weights during their pregnancy, their pelvic floor is going to be super tight and it's going to impact their labor, like it's going to cause tons of labor stalls or result in a C-section. Is this something that you hear a lot too?
It's lifting, but also like externally rotated type movements. So like ballet dancers or even like gymnasts that do this like really externally rotated movement usually will have a tighter pelvic floor that people can notice. And then I've heard a lot of like doulas will be like, my client won't stop CrossFitting. And I keep telling them this is going to like hurt their labor if they keep lifting these weights and doing these movements, when it's not necessarily like these movements are like what's going to cause.
Yeah, like touching a weight does not make your pelvic floor suddenly tight.
Like ballet dancing doesn't make your pelvic floor tight. Like doing these like types of exercises is not the reason that like they're having this stall. So it's not necessarily the sport that's causing this. So like the lifting the weights isn't causing it. It's not the ballet dancing or the gymnastics. It's the repetitive movement patterns you're doing during these things that causes the like uneven tension.
So with these sports that really favor a lot of that external hip rotation, so toes are pointed outwards a little bit more, and spinal extension, so you're arching your back a little bit more, this can reinforce like this movement pattern of extension, external hip rotation kind of repeatedly, and we can kind of get stuck in this position. And because we're stuck in that position, it can impact tension within the pelvic floor. And so our pelvic floor is attached to our pelvis, and different types of hip movements impact what type of stretching and tightening we have within the pelvic floor. So most of us do not have an entire pelvic floor that is super tight. Typically, there's portions of it that are a little bit tighter. And with athletes in these sports, we tend to have a little bit more tension to the back half of the pelvic floor. However, it's also important to note that during pregnancy, we also tend to favor this position as well of external hip rotation and extension because it's comfortable. It's more comfortable for us to be in this position. And so we're already living in extension and external hip rotation just in general during pregnancy, because if not doing those sports meant your pelvic floor was totally ready for labor, then the majority of us would not have labor stalls, because the majority of people do not exercise during their pregnancy. However, people that don't work out during their pregnancy also potentially could have issues with pelvic floor tension and with labor stalls during their birth. So I think it's really unfair to be like, if you touch a weight, if you do dance, if you do this one sport, you're in trouble. When it's really not the sport, it's the movement pattern and reinforcing that movement pattern with repetitive movements. And so how can we overcome it? Because external hip rotation and extension are really important for sport because it's a power position. That's how we generate power. It's also a posture position that we favor during pregnancy because it's more comfortable. And so what we can do during pregnancy to help kind of balance that is we can incorporate exercises that are kind of the opposite. So again, not just sagittal plane, not just external hip rotation and extension. We also want to incorporate that frontal plane, so that lateral movement. And we also want to incorporate that internal rotation of the hip with that transverse plane.
Let's take a break from this episode to hear from our sponsor, Needed. Did you know that during pregnancy, your protein needs are higher, and it's really hard to get that from just food? So adding in a collagen protein supplement is a really easy way for you to meet those protein demands during pregnancy. Our favorite collagen protein is Needed. They're very intentional with their ingredients and the testing of their collagen protein. So they are Clean Label Project Award, which means that not only do they do third-party testing, but this award also did third-party testing to say that there's not additional things within the collagen protein. It's very clean and it mixes in really nicely, doesn't add a flavor, which are also wins in my book. And if you want to try out Needed's collagen protein, you can use our code MamastePod to get 20% off your first order.
So one of the things that we recommend incorporating into your prenatal workout routine and just your daily routine is the MamasteFit birth prep circuit, because our birth prep circuit is targeting these common areas of tension that all of us generally have. We all tend to have really tight lats, really tight hip flexors, because again, common posture during pregnancy is extension and external hip rotation. And then if you are an athlete, you also tend to reinforce that positioning because it's a power position. And so we want to be able to release the lats and release the hip flexors so we can find more of a rounded position, more of that posterior pelvic tilt, rounded back position. The next thing that's incorporated into the MamasteFit birth prep circuit is internal hip rotation with hip shifted movements. And so this is also incorporating internal pelvic rotation because again, they're a little bit different. And so with the hip shifts and that internal hip rotation, we are stretching more of the back half of the pelvic floor, where again, a lot of us tend to have more tension. So we're releasing tension to the back half, which then can translate to more mobility within the pelvis, more mobility within the pelvic floor. And the best position or the best posture is not neutral or completely upright. It's the next position that you can move into. It's more important that you can change positions than it is to maintain a perfectly neutral position. And it's also not great to just maintain our normal pregnancy posture either. And so again, like Roxanne was saying, and I've hopefully been reinforcing, the sport itself does not equal tight pelvic floor. Touching a weight doesn't automatically tighten your pelvic floor. It's not like your pelvic floor is scared of the barbell. So it is really beneficial to continue to lift and to do the sports that you love during your pregnancy, because again, we're looking to achieve at least 150 minutes of moderate intensity exercise per week, which that's the minimum. That's the minimum recommendation. And so if you don't enjoy the sport that you're trying to do during your pregnancy, it's going to be really hard to stay motivated for 9 or 10 months and to do that much. So I want to make sure that you're doing something that you enjoy, but that you feel confident that it's not going to cause issues for you. And so do the sports that you love, but again, make sure we're moving in all 3 planes of motion. We're incorporating exercises in different directions. We're incorporating the MamasteFit birth prep circuit. And a common question that we get is, when should I start it? When should I start birth prep? Whenever.
No.
There is no. Because we don't know how long it's going to take to kind of overcome areas of tension. And it's not bad to start in your first trimester with the birth prep circuit. It's not bad to start in your second trimester. It's not bad to wait till your third trimester. But if we can do it throughout the duration of our pregnancy, it's just going to, one, make you more comfortable throughout your pregnancy. And then it's just going to give you more time to ensure that those movement patterns are accessible to you. So we talked about how we can use our prenatal fitness to help us stay strong throughout our pregnancy by ensuring that we're incorporating the 3 different planes of motion. So we have that front to back plane, side to side, and then also rotational. And this is going to bring more balance to our pelvic floor, to the musculature that's supporting our body, which is going to translate to more comfort throughout your pregnancy. And now we do have an entire episode that we did all about pelvic pain and helping you overcome that pelvic pain. We do incorporate a lot of pelvic stability exercises within all of our prenatal fitness programs to help you stay strong throughout your pregnancy. And so if you want to dive deeper into that, we'll link that episode down below, and we'll also link our prenatal fitness programs if you're like, I just want to join what you've already created and seems to work for a lot of folks. But let's talk about how we can use our prenatal workouts to prepare us for birth. Because again, prenatal workouts are not just a bunch of pregnancy-safe exercises. Like, it's not just a general workout program that just omits sit-ups and crunches. Like, we can do so much more with our workouts to create space within our pelvis and then also to release tension within the pelvic floor. So before we dive into what exercises we can do, we need to discuss what are the levels of the pelvis. How do we create space within the pelvis? Because a common thing that I'll see is like, prepare for birth, do deep squats and butterfly and all of these externally rotated positions, which is great to helping create space in the top of the pelvis, but it's not helping us create space in other parts of the pelvis because there's no one movement that opens the entire pelvis. There's no one movement that stretches your entire pelvic floor. And so let's break down what are the pelvic levels. So the top of the pelvis is the pelvic inlet. This is where your baby's going to first enter or engage into the pelvis. This pelvic level is going to open more with external hip rotation with abduction, so legs moving outwards. And so if you think like a deep squat pose, that's going to be creating more space front to back in the top of the pelvis. The good news is we all can do that. That is an easy position for us to get into because we favor this all the time with our workout patterns, with our movement patterns. This is a common postural tendency. We love external hip rotation with abduction, and we love to create space side to side in the top of the pelvis. Another movement that helps to create more space within the top of the pelvis or makes it easier for your baby to enter into the pelvis is that anterior pelvic tilt where we're arching in the back. And so that's just going to change that pubic bone angle to make it easier for baby to kind of slide in. So it's not necessarily like creating more space within the pelvis, but it's just making it a little bit easier for baby to get in. And anterior pelvic tilt or that spine extension makes it easier for you to find external hip rotation. So it could kind of translate to more space side to side in the top of your pelvis. Again, both of those movement patterns we love during pregnancy.
Easy peasy.
We already live there. However, with the pelvic inlet, a posterior pelvic tilt where we're tucking the butt underneath creates more space front to back in the top of the pelvis. So it's creating more so it's increasing the pelvic diameter front to back. The reason why is we have this junction between our lumbar spine and our sacrum that attaches to the back of the pelvis. And when we tuck our butt underneath, that sacrum tucks underneath and that promontory pushes backwards. And so it creates more space. However, as we've discussed, a posterior pelvic tilt tends to be a little bit more challenging to find during pregnancy because one, it's the opposite of our common postural tendency. And then two, it's not a common movement that is reinforced in like athletic programming. So in a lifting program, primarily we're going to be focusing on that extension with external hip rotation, but we also want to make sure that we're incorporating that posterior pelvic tilt, so the ability to find this rounded position. And this can, again, start with those mobility exercises where we release tension in the lats with that forward leaning lat release, which is in the MamasteFit birth prep circuit, and the hip flexor release, which is going to allow us to come out of that arch position to find more neutral and then to tuck underneath. And then we have to think about what type of strengthening exercises are going to help to pull the pelvis into that posterior position, which are going to include like deadlifts or hamstring strengthening exercises because it's going to pull the pelvis from the back, plus adductor strengthening exercises or inner thigh strengthening exercises because that also helps us to find more of that posterior position. So when we're thinking about creating space in the top of the pelvis, absolutely incorporate your squats and your wide knee positions, those butterfly poses, all those mobility things that are like super common, like birth prep exercises. But we also want to incorporate exercises that help us to find that posterior position. So mobility exercises that release tension in the lat musculature and the hip flexors, and then strengthening exercises that target the hamstrings and the inner thighs can help us to create more space in the top of the pelvis.
So with the inlet, sometimes you might notice if baby's having trouble engaging, like your stage of labor may not match to what you're feeling in labor because your body's working a little bit harder to get that baby into the pelvis. And sometimes your cervical exam could almost be like you're 8 or 9 centimeters, but your baby is still not yet engaged because your cervix is dilating from the pressure from the amniotic sac, but it's not actually the baby's head just yet because baby's still up here. It can just be how you labor. Some people, their babies don't really engage until like shortly before the baby is born and just shoots through the pelvis. But it could just be that your labor is progressing, but baby is not pushing down because they're having that trouble engaging. And that's when we want to work on doing some things to kind of create the space that we go over very in depth in our childbirth education course and then our prenatal fitness courses.
So common movement pattern trends that I see that may make it harder for a baby to enter in the pelvis is that you're having a hard time finding that posterior pelvic tilt. And so if your workout programming really predominantly focuses on that sagittal plane, that front to back type movement patterns, and you are just like really into like rib flare and spine extension, like I would definitely recommend really focusing on helping you find that more rounded position throughout your pregnancy. Like, can you tuck your butt underneath and find more rounding, like with back expansion breathing exercises, releasing lat tension and hip flexor tension? Because this is going to be something that'll probably pop up during labor if you have a hard time creating that space for baby to then enter into the pelvis. And so again, this is how we could use our prenatal workouts to help us prepare for birth and to help us to create the space that we need within each pelvic level. The next pelvic level is the mid-pelvis. And so this is the bony structure that baby's going to be navigating through. And for most of us, where baby's going to spend most of the time because it's the narrowest space. There's a lot of structure, not just bone that baby is navigating through. There's tissues. They're moving through the actual muscle, like of the pelvic floor, of the uterus. And so there's a lot going on in this space. The mid-pelvis is going to open more with asymmetrical type movement patterns. So one hip is doing something differently than the other. So one hip is in an open hip position. One hip is in a closed hip position. And so the mid-pelvis can then be divided into two levels. So we have our upper mid-pelvis. This is where baby begins their rotation into the pelvis. And then we have the lower mid-pelvis, which is where baby finishes their rotation underneath the pubic bone. The upper mid-pelvis opens very similarly to the inlet. And so we have external rotation on one side with abduction, so leg moving outwards, and that anterior pelvic tilt. So that slight arching is going to help to create that asymmetrical space in the upper mid-pelvis to help baby begin their rotation. When we create space in the upper mid-pelvis, the opposing lower mid-pelvis tends to open up. And so we have kind of this diagonal opening that happens within the mid-pelvis. And so just kind of like alternating and kind of wiggling back and forth, like when we're in labor, can help baby kind of wiggle and rock through. The lower mid-pelvis is going to open more similarly to the pelvic outlet, which I know we haven't gotten to yet, but here's your sneak peek. The lower mid-pelvis opens more with internal hip rotation on one side with adduction, so legs moving in or knee coming in closer with a posterior pelvic tilt, because a posterior pelvic tilt makes internal rotation easier to achieve. And so I know for the inlet, we said posterior pelvic tilt creates more space front to back. That's because of that sacral promontory, or that junction between the lumbar spine and the sacrum moving backwards with a posterior pelvic tilt. When it comes to the lower half of the pelvis, a posterior pelvic tilt makes internal hip rotation easier, so it makes it easier for us to create more space in the bottom half of the pelvis. And so mid-pelvis, again, it's just side-to-side type movement patterns, asymmetrical type movement patterns, shifting weight from leg to leg. And as we've kind of been discussing, that external hip rotation with abduction, with that anterior pelvic tilt, we love that during pregnancy. We're already there. We're good. We're good with the upper mid-pelvis, typically. It's the lower mid-pelvis that we're going to see more issues with during labor and that we are going to want to focus on a lot during pregnancy. So this is where we're going to be really focused on finding hip shifts throughout our pregnancy, really focus on finding more of that internal hip rotation. And the best way to kind of prepare to open the mid-pelvis is with one-sided movement patterns. So like single leg movements or staggered stance movements. And so what you'll do is when we're doing like our lunge or we're doing our staggered stance movement, we're going to find internal hip rotation at the bottom. So when we have more flexion in the hip or we have more bend in the hip, we're thinking belly to thigh, which is going to bring more length to that glute and bring that hip into internal hip rotation. And then when we stand up, we're going to find more external hip rotation. And so this is going to help us to create that space throughout the entirety of the mid-pelvis. So with our single leg movements, so like our lunges, our split squats, our staggered stance RDLs, we're thinking internal hip rotation, so closed hip positions at the bottom, and then open hip positions at the top. And if that was confusing, we will link a breakdown exercise down in the notes below so that you can see like an example of what that even looks like. And then we also have an entire playlist on YouTube that is birth prep focused workout. So how to open each pelvic level with different types of exercises. And so some of the common things that I like to incorporate within the MamasteFit prenatal fitness program to help with opening the pelvis, particularly the lower mid pelvis, is going to be those internal to external rotation lunges, split squats, step ups, staggered stance RDL. So all of these things are helping you to kind of shift back and forth between the two.
And it's important to note that when you're doing these like staggered stance, internally rotated type movements, the movement is coming from the hip, not necessarily the torso. So we'll have people that come into the gym to work out. And yes, just turning your torso will bring you into some internal rotation. But a lot of the times I'll see people who do have trouble with that internal rotation. They're literally just moving like their upper torso. So their body is moving and they're like, yeah, I'm internally rotating. But like their hips are still in a neutral position. And like that's where we want the movement to be coming from, not necessarily just the torso. So when you're in that movement, if you turn your torso, but your hip did not move into internal rotation and you're not feeling almost like
more of a stretch
in that glute area, you're probably needing to actually almost like feel like you're pushing your knee backwards, and that will feel that internal rotation a little bit more. You'll also might feel, if you are weaker on that inner thigh, you might feel that inner thigh turn on as well. And that's another really great indicator that you are actually in that internal rotation movement, not just like turning your torso.
Yeah, I see that all the time. Even with my husband, when I'm trying to help him with like hip shifts, it's like just upper body.
Yeah.
And I'm like, we got to move our hips too.
Yeah.
So there's tons
connected.
There's tons of exercises that you can do to help with like the internal hip rotation, helping you find more of those hip shifted movements as well. And we have tons of them within the prenatal fitness programs. And we'll link a few examples in the notes below because it is kind of hard to explain them just verbally, like with the podcast. Even with the YouTube like podcast video, like I'm not showing you the exercises. I'm just holding a pelvis in my hands. So lower mid pelvis is typically where we're going to see more like late labor stall issues. So like you're like 8 or 9 centimeters and baby is just like not getting any lower, or you are just stuck at like 8 centimeters, or you're pushing and you've been pushing for like forever and baby is just not getting underneath the pubic bone. Lower mid pelvis is typically where we have those issues. And so this is why it's so important during our prenatal workouts to ensure that we're incorporating that internal hip rotation, that we're incorporating those hip shifted movements, that we're incorporating exercises that strengthen the hamstrings and the inner thighs, because that also helps to not only pull our pelvis in that posterior position, but also into internal hip rotation. So again, I really love deadlifts and RDLs, especially like stagger stance, where we can focus on the one-sided movement to incorporate that internal hip rotation, especially for lower mid pelvis. But we also want to focus on strengthening the inner thighs. So like Copenhagen planks, which are not fun, but they're really, really great for strengthening your inner thighs. We really want to start incorporating that inner thigh strengthening as well, because during pregnancy, that musculature tends to get a little bit lengthened and stretched. Because again, we love external rotation. It's more comfortable for us. So as you're preparing for birth, incorporate those one-sided movements, particularly single leg or staggered stance movements, and incorporate that hip movement with it. So internal hip rotation, external hip rotation. Also make sure that we're targeting the hamstrings and inner thighs. And again, we incorporate that all within our prenatal fitness program for you. So you don't have to reinvent the wheel if you don't want to. If you do, hopefully this episode gives you enough tools to do so.
And with the mid-pelvis, like opening type movements, if you have pelvic girdle pain, this is a common question. Okay, great. We want to do these asymmetrical movements on single legs, but I have really bad pubic bone pain whenever I do a single leg movement. there are modifications that we can utilize that we do include in our prenatal fitness programs as well as our pelvic stability program so that you can still get the benefits of doing these asymmetrical movement patterns. Because I feel you. I had bad pubic bone pain with my first pregnancy that was like almost debilitating. And then with the second and third, I still had it a little bit. I did have to modify a lot of these asymmetrical movement patterns because it did like irritate sometimes my pubic bone. So there are things that we can still utilize to still focus on this mid pelvis, being able to get into that internal rotation to open the lower mid pelvis to be able to prepare for birth. You can't just like expect to open that lower portion while doing like both legs. It's just a little bit harder to find that internal rotation without utilizing like asymmetrical patterns.
The hip shifted movements tend to be like really helpful for pelvic girdle pain, both for front pubic bone pain and back SI joint pain, because the legs are not spreading apart. Because typically it's the spreading apart that is like really uncomfortable for especially SBD pain. And so with the hip shift, the legs are still close together. You can even squeeze a ball between your thighs as you do them. But we're finding that rotation in the pelvis to create that type of space. And sometimes that release of tension can really help with pelvic girdle pain as well. And so pelvic girdle pain in general is not a requirement of pregnancy. You do not have to be in pain because you were pregnant. There's so much that we can do to help overcome that. But like Roxanne said, there's also tons of modifications that you can incorporate. And we incorporate them within our programming for you. We have tons of blogs on modifications as well. Like we can still prepare to open our pelvis for birth in a way that is not painful for us as well. And then hopefully get to the point where we've resolved it enough to where we can then do more of these wide leg positions, more of the single leg positions. But if we're having tons of pelvic pain, using resistance bands to kind of increase inner thigh activation seems to help. Staggering the stance, so having a little bit more support with the stance, and then also a lot of the hip shifted movements seem to like really benefit.
Which is all the things that I did. I just know like lunges did not serve me great.
And that's okay.
So, and it's a great asymmetrical
movement.
Really is. So walking lunges, maybe not best. Hold on to stuff.
There's options that we can do available to still find comfort while creating that space within the pelvis. The bottom of the pelvis is the pelvic outlet. And like I said before, this is going to open similarly to the lower mid pelvis. And so we have internal hip rotation on both sides that creates more space side to side with adduction. So knees in, ankles out. And then that posterior pelvic tilt is just going to make it easier for you to find more of that opening at the bottom of your pelvis. So if you're still in a really extended spine position and you try to torque your hips into internal rotation, it's not going to impact the pelvis at all. Like it's going to make it really hard for you to find that position. And so finding that tucked position can then help you to create that space. So the position of your pelvis influences how you can then create that space as well, which again, I know probably is already making this more complicated than it may seem, which is why just grabbing our program would probably be easiest. But in addition, we want to be able to create space front to back in the bottom of the pelvis as well. And this is where lat tension is going to be really helpful because the lats, while they're not attached to the sacrum, there's a bunch of like tissue and fascial lines that do attach to the sacrum. Lat tension can help to kind of pull the bottom of the tailbone outwards to create that space front to back. And so we have our knees in, ankles out to create that space side to side. And so we're going to be able to do that with like deadlifting type movements, adductor strengthening type movements. Those hip shifted movements are going to be super beneficial to preparing to open the bottom of the pelvis, plus back strengthening exercises to help us to generate lat tension to then pull that bottom of the sacrum backwards to create more space from front to back. And so when we're preparing for like pushing, because that's typically where baby is going to be when we're pushing is near the outlet, we want to think about upper back strengthening exercises. So like pull downs, bent over rows, dumbbell rows, like anything that's strengthening the back musculature is going to be beneficial for pushing. Plus, pushing is a lot of like pulling onto your legs and things like that as well. In addition to the exercises that help to create more internal hip rotation, such as the deadlifts and adductor strengthening exercises, but we can favorite more like bilaterally when it comes to the pelvic outlet. So hopefully this episode has helped you to understand what you can do during your workouts to not only stay strong throughout your pregnancy, pain-free throughout your pregnancy, but also how you can incorporate exercises to help you to actually prepare for birth. Because again, prenatal workouts are not just a collection of random exercises that are pregnancy safe. We want to make sure that we're choosing exercises that help us to move in the different planes of motion, so front to back, side to side, and rotational movements to support balance throughout our body, which is going to help with more of that pain as well. Plus, incorporate exercises that open each pelvic level, because again, there's no one movement that opens the entire pelvis. There's no one movement that stretches your entire pelvic floor. We want to ensure that we're incorporating different types of hip movements, such as bilateral external hip rotation, bilateral internal hip rotation, so both legs externally rotated, both legs internally rotated, plus asymmetrical movements, so one leg in external rotation, one leg in internal hip rotation, and then tons of hip shifted exercises as we are preparing for birth. And this can be a combination of strength exercises plus mobility exercises. So it's not like an all or none, like you don't have to only lift weights. You can also do like stretches and stuff as well. And so hopefully this episode was helpful for you to know what to even do for your prenatal workouts. But if you want more, check out our online prenatal fitness programs where we provide you these daily workouts. We've already figured it out for you. So we have been working with in-person prenatal clients for over 7 years now, which is a little bit different than some of the online trainers that like just had a pregnancy, took some courses, and then developed some programs. Like we actually work with in-person clients exclusively during their pregnancy. We've been pregnant ourselves and kind of tested and refined our programs. We work with pellet floor physical therapists and to kind of look at and review our programs as well. So our programs are like very well developed. I'm pretty proud of them. But you can check them out on our website at MamasteFit.com. We have 2 different options with it. We have the Team Builder app, which is going to be a list of exercises with short demo videos. This is going to be a more traditional style of workout delivery. So self-paced workouts, it's great for somebody that wants to work out in a gym, wants to lift with a barbell. And then we have our on-demand workouts, which is full-length workout videos that you follow and work out with at the same time, plus yoga. So we have the on-demand for yoga and then for strength training as well. So you can check out all of our options on our website. And you can also bundle it with childbirth education and pelvic floor prep to save an additional 15% off. And you can use code STORY10 to get 10% off any of our online offerings.
This podcast is sponsored by Needed, a nutrition company focused on the perinatal timeframe that both Gina and I have utilized during our pregnancies, postpartums. We're both still taking it now. Our husbands take it. I even give our immune support to my children. So we love Needed so much. And if you want to check out Needed, you can use our code MamastePod to get 20% off your first order.